When we come back, we're going to talk about osteoarthritis, degeneration of the knee. It's a very painful condition. It's treated by many ways, including medications, but there's something called rooster comb or hyaluronic acid injection that makes a big difference in these patients. We'll be back.
This pain topic is brought to you by the Dr. Carrasco Pain Cream. Buy it today. Call 210-614-4825 or online at carrascopaininstitute.com.
I'm Dr. Carrasco.
I'm Dr. Alex DeJesus.
Dr. DeJesus is an expert in treating people with rheumatoid disease and osteoarthritis. Today we're talking about osteoarthritis of the knee, degeneration of the knee. Alex, what do you do to treat that?
You know, people show up to the office, and the most common cause to come to the office is knee pain. My knee is hurting, I'm not feeling good. So first we got to take a little history and see where you're finding. So the patient's going to say, typically going to say, I get up in the morning, I feel good, but when I start walking, my knee hurts. If I go up and down the stairs, my knee hurts, and sometimes I hear a noise, a crunchy noise in my knee.
Well, let's do an exam. I mean, I don't think I'll have a crunchy knee, but let's see. So Alex, how do you examine, for the people at home, how can they examine their own knee?
Well, first, in a sitting down position is quite the correct position to examine your knee, and you are going to put your hand over your kneecap. So put over your hand over, and then you're going to stretch the knee and straighten it out all the way up, and then put it down, okay? And then you're going to kind of feel on that kneecap, is it crunchy? Is there feeling there? Is there a click or pop, okay? And obviously, the knee pain can be when you're standing and walking. In this position, your knee may not be hurting. So how did it feel?
It felt pretty good, Alex, but I have seen patients that I examined that I feel a bunch of creaking and popping as I move the knee up and down. And I said, you probably have arthritis there.
Well, and that is simple as it sounds, it's probably correct. That's all it takes to suspect the patient has arthritis. So in the office, what I do is I'll put a sonogram on the knee and look at the ligaments, the tendons, the bursas. And the interesting thing about that is right away I can see if there's fluid in the knee or not. So obviously fluid means arthritis.
So how do you make the diagnosis?
The diagnosis is with a clinical exam, a sonogram, and an x-ray.
All right, now we made a diagnosis. How are we going to treat this problem?
This patient should be on an anti-inflammatory medication, which by the time they get to me, they've been on for months or years.
Right. Motrin, Advil, Aleve, something like that.
Something prescribed or something over the counter, and some Tylenol, and then they rub everything on their knee. You know how it is because the topicals do work. I mean, don't you remember grandma rubbing stuff on her knees and the shoulders, right? Yeah. Nowadays we have very effective topicals. So if that doesn't work, they're going to come to the office, and that patient is a candidate for a knee injection, a therapeutic knee injection.
Well, patients come to me and says, I had a rooster injection. What does that mean?
Well, I've seen them walking around like this and clucking in the office. I've seen them walking and clucking because they got their rooster shots. That's something the patients say quite a bit. Let's look at this knee and put it.
So this was kind of like my knee here.
Okay, so a rooster comb injection is hyaluronic acid or liquid cartilage. There are many other liquid cartilage brands that don't have rooster comb, but they all work. The good thing is that they all work. So here's the knee, and we're going to put it
bend it so I can kind of
a little bit like in a 30-degree position, and then we're going to put the needle behind that kneecap and into the joint space, just like this. And the medicine gets squirted in. So it could be one every week for 3 weeks, one every week for 5 weeks, or one just the whole thing at once. But the whole thing at once is a lot of medicine, and the patient's going to have to rest a couple of days, or else that knee is going to become swollen from the medication taking place and working in that knee.
Okay. And how long should the effect last?
A minimum 6 months, 6 to 8 months is the average. I have patients going on 2 years, and they have not required a second injection. It can be a long time. So just remember, when it's one injection, it's a lot of medicine. You're going to have to take a couple of days from taking it easy from that knee when you do that.
This pain topic is brought to you by the Dr. Carrasco Pain Cream. Buy it today. Call 210-614-4825 or online at carrascopaininstitute.com.